morning, viewers. Myself, Dr. A.M. Karthigesan, cardiologist and electrophysiologist, Apollo Main Hospitals, Chennai. Today, we are talking about newer technology called physiological pacing, otherwise called his bundle pacing. What is about it? It is basically, you have all heard about the pacemakers, which we have been implanting for more than 5 decades for the patients whom the heart rate's own heartbeat is dropping below the normal rate, and then they are getting symptoms like giddiness, loss of consciousness, and breathlessness. However, we have been noticing once you implant the pacemaker, it is down the line, the patient gets into LV dysfunction, heart failure, breathing difficulties, because the heart is being artificially stimulated through the electrical device instead of the normal electrical system. To overcome that, the recent technology called physiological pacing or his bundle pacing, where we put the pacemaker as usual in the routine collarbone, but the wires which is connecting the heart to the electronic device placed in a different location rather than traditionally where we used to put it in the RV apical area. Here the electrical wire is placed near the patient's own electrical system so that the electrical impulse from the electronic device goes through the patient's own electrical system instead of artificially stimulating the different area. By giving electrical current to the patient's own electrical system, the heart beats the way it normally beats so that it will not cause any disadvantages of traditional pacing, which by pacing by the RV apical area. When the electrical impulse passes through the natural electrical system, so the patient doesn't feel that the pacemaker is working, and he doesn't experience any long-term side effects like LV dysfunctions and breathing difficulties and atrial fibrillation and stroke and so many side effects of the traditional pacemakers. This technology has been introduced last few years, and we have been Apollo as a pioneer in adapting the new technology. We have been using this technology in the last more than a year, with a good success rate. And recently, we are fortunate to conduct a symposium to spread this awareness among the physicians and then as well as to the cardiologist. And also, we are trained physicians to how to do this procedure so that many patients will get favorable effect instead of getting the side effects to the traditional pacemaker. Thank you. Good morning, viewers. Myself, Dr. A.M. Karthigesan, Senior Cardiologist and Electrophysiologist, Department of Cardiac Pacing and Electrophysiology, Apollo Main Hospitals, Chennai. Today, I would like to introduce a new concept in the pacemaker technology called physiological pacing or his bundle pacings. So what is about this new technology? So even though we have been implanting pacemakers for more than 5 decades for the low heartbeat patients, which causes a lot of side effects once the patient heart is stimulated artificially through the pacemakers. It causes LV dilatation, LV dysfunction, heart failure, and breathing difficulties, and atrial fibrillation, and stroke, and so on. So many side effects can happen. Down the line, somebody lives with the artificial pacemaker. To overcome that, we have introduced a new technology called physiological pacing or his bundle pacing, where these electrical wires, instead of putting in the traditional location, it has been placed near the natural electrical system. So by stimulating the heart through the natural electrical system, so the heart doesn't feel like it is artificially stimulated, so that the side effects of the artificial stimulation has been avoided. So this has been adapted last few years. Being a pioneer in introducing new technology and new concepts, Apollo being the pioneer, and we have been doing this newer pacing technology called physiological pacing since last 1 year. And the studies have shown that it has a tremendous impact on the patient's life as well as the quality of life, as well as avoiding the side effects of the traditional pacemaker. Good morning, viewers. Myself, Dr. Karthigesan, cardiologist and electrophysiologist, Apollo Main Hospitals, Chennai. You are all aware that pacemakers are commonly implanted for the patients who has a low heartbeat and getting symptoms like breathing difficulties and giddiness and loss of consciousness. But however, once you implant the pacemakers, their life is saved, but however, they feel the side effects of the pacemaker by causing LV dysfunction, heart failure, breathing difficulties down the line after a few years of implanting pacemakers. To overcome that, we have introduced a new technology called physiological pacing, that is his bundle pacing, Instead of putting the electrical wires, pacemaker wires in the traditional location, we put it in the close to the natural conduction system so that the patient doesn't feel the heart is being stimulated artificially through the pacemakers. It works like a natural electrical system. So thereby we are avoiding the side effects of the regular pacemakers and getting advantage of newer technology called physiological pacing. Thank you. Good morning, viewers. Myself, Dr. Karthigesan, Senior Consultant Cardiologist and Electrophysiologist, Apollo Main Hospitals, Chennai. Our own heartbeat, which is ranging from 50 to 100 beats per minute, it's maintained by the natural cardiac electrical system. When it fails, the patient's own heartbeat drops below 50 and patient gets into giddiness, loss of consciousness and breathlessness. To save their lives, we implant pacemakers, which is an electronic device which maintains their own heartbeat, whatever the desired range. But traditionally, it has been placed in the RV apical region. Down the line, when someone's heart is maintained by the pacemaker, they gets into problems like heart failure and breathing difficulties and strokes and irregular heartbeats. To overcome that, we introduced a new technology called physiological pacing or horizontal pacing, where we put the pacemakers and place it near the natural electrical system so that the electrical impulse from the pacemaker passes through the natural electrical system of the human heart. Thereby, it prevents the heart to fail in down the line, as well as it maintains their own pumping function in a normal manner. This technology can be implemented in the patients whom already received the pacemakers and their heartbeat pumping function is getting down and they are getting admitted with the heart failure. To avoid this, the new concept called physiological pacings, so putting the pacemaker in the traditional, instead of traditional putting the, I think. Good morning, viewers. Myself, Dr. Karthigesan, Senior Consultant Cardiologist and Electrophysiologist, Apollo Main Hospitals. Human cardiac electrical system maintains our own heartbeat in the range of 50 to 100 beats per minute. When our own electrical system fails, patient gets into low heartbeat, associated symptoms like giddiness, loss of consciousness and breathlessness. To save their lives, we implant electronic device called pacemakers, which maintains our heartbeat in the range of 70 to 80 beats per minute, whatever the rate which we desire. However, human heart is stimulated artificially by pacemakers, leading to a lot of problems like heart failure, breathing difficulties, as well as stroke, breathing difficulties. To overcome that, the newer concept called physiological pacing or horizontal pacing, where we stimulate the heart through the natural electrical system. Thereby, we can prevent the side effects of the traditional pacemakers. Thank you.
Thank you.